Welcome to the Real News Network. I'm Paul Jay. We're in Burlington, Vermont at the Sanders Institute gathering. One of the main themes of this conference, and sure to be one of the main themes of the run-up to the 2020 elections, is health care and the demand or call for Medicare for all. Well, one of the people who's very involved in this campaign, Kelly Coogan-Gehr, is Assistant Director of Public and Community Advocacy at the National Nurses United. She served as Education Director for NNU, as the Director of the Washington State Labor Center, and as a labor representative for healthcare workers. Kelly currently helps operationalize NNU's National Medicare for All campaign. Thanks for joining us.
Thank you.
So you opened the panel yesterday, which was on healthcare, which is, as I say, one of the, according to polling, the #1 issue that everyone was concerned about in the midterm elections, and sure to be at the top of the agenda for 2020. The campaign for Medicare for All, which everyone that watches us knows what that's about, it's a reform that's very important. People are very involved in it. But even if you win it on itself doesn't transform what's happening in this country. And you tied this together in your panel in an interesting way, where you talked about this is a way to get people engaged in the whole question of democratization.
Right,
so
that's right.
What were you getting at?
Yeah, so one of the things I said in those opening remarks was that, yes, everybody knows that Medicare for All guarantees health care to all Americans. Yes, most unions understand that it sort of, by delinking health care from employment status, it increases the industrial power of working people. Medicare for All would. But what we are seeing with the fact that right now 18% of our gross domestic product is spent on healthcare. By 2026, it will be over 20% of our gross domestic product. That's an entire fifth of our economy. And so essentially what Medicare for All would do is bring back to the people a fifth of our economy, is essentially democratize an entire fifth of our economy that's now essentially extraordinarily privatized, and not only that, but profiting off of the suffering and pain of most Americans.
So the link between the campaign and the bigger picture is partly about this economic democratization of a sector of the economy. But in Canada, we kind of have that. I say we because I grew up in Canada. That in itself doesn't get there either, because you can't say Canada is fundamentally different in terms of its politics than the United States. We have a premier in Ontario who's pretty Trump-like, Rob Ford.
That's right. And so if I could just interrupt real quick, I mean, I think that one of the reasons why people are craving a mechanism that, to say it socializes medicine is not quite correct. I mean, the government would be the single payer of the healthcare system. But we are in a proto-fascist moment right now. I mean, as you just said, the sort of deep economic discontent and frustration that economic neoliberalism has created amongst the working class is being articulated in these horribly racist ways, in these sexist ways. And so I think that the left is sort of understanding that we need a broader movement, and that broader movement is in healthcare justice, to really mobilize people around fighting for their economy, not just for their healthcare, but for their economy. And in Canada, I mean, and the same goes for NHS. I mean, privatization is just absolutely rearing its ugly head. And that's why our nurses here in the United States are really in support of the National Pharmacare campaign that's happening in Canada right now, because pharmaceutical pricing is the third worst in the world. 1 in 5 families can't, and this is in Canada, can't afford drugs. The only way that a Canadian can actually get a prescription covered and paid for is if they're admitted into the hospital. And so you have Canadians, for arbitrary reasons, trying to get admitted into hospitals just so that they can be prescribed medications. So it's not a perfect system. And because we live in a capitalist society, we are always going to be fighting against the encroachment of privatization. There's always going to be various entry points for privatization. And we see with the NHS that's what, in terms of the public-private partnerships that are happening right now with the private finance initiative, this is what's happening is that essentially the private sector, through austerity measures, is trying to come in. You know, the government starves the system. It makes the system inefficient, understaffed, and then the private sector comes in as this knight in shining armor trying to save the public system from itself, when it's really the austerity measures that created the problem in the first place. And so anytime, I mean, that's what capital does. I mean, capital finds the rifts and the cracks, and it finds a way to get inside them. And so, of course, winning Medicare for all isn't going to be the end-all, be-all. And, I mean, this is one of the things that National Nurses United has been saying for years, is that the core issue is not just democratizing our healthcare system. It's also addressing underlying problems of healthcare restructuring, which, you know, bring Taylorism into the healthcare workplace by trying to make work practices more efficient.
Taylor's the guy that did the time clock on this automobile assembly line.
That's right. That's right. And trying to find ways to de-skill and displace through health information technology.
Well, I think you're making a really important point, and I don't hear it being made very often. Bernie, in his talk yesterday, was talking about it's not just about concentrated wealth. Concentrated wealth is concentrated political power. But he didn't go, to my mind, the next step, which is, what do you do about that concentrated wealth and concentrated power? I don't see how you counter that without building out the public sector.
Yeah.
And the most fifth of the economy, if you turn that into public sector, you start to take away some of that power.
That's exactly right. I also think that the way to counter it, and this is why NNU has turned to this methodology of big organizing. The way to counter it is actually to build a social movement that scales very quickly. I know that for those folks who heard the panel, they heard that we don't counter ourselves to the Alinsky model, but we build on the Alinsky model. So
explain what that means.
So basically it's and no one thinks that this would ever be replaced, but the idea of the significance of the one-on-one personal conversation, the one-on-one organizing conversation, the one-on-one relationship to build trust, and from there, workers become empowered, and ideally over time they set up organizations that represent their interests and essentially get them a seat at the table. But we have seen for the past half century what getting us a seat at the table has looked like, and particularly in healthcare. I mean, you know, you go back to the 1950s, union contracts guaranteed workers healthcare for life. We had 33% union density. That's not the case anymore. I mean, work is too precarious, union density is too low, no one can count on a job for life. But we gave up some of our biggest weapons, the primary one of those being the strike, to have a labor management partnership relationship where we would be guaranteed certain benefits for life, and one of those was health care. And in that, we lost a great deal of power. And so we are saying right now that we need to build on this Alinsky model because it's not scaling up quickly enough. And what we want to do through that is use the technologies that mediate our everyday lives to help us literally reach hundreds of thousands of people in a matter of weeks.
The movement's obviously having quite a bit of success. This Medicare for all is becoming common term, and a lot of people running for office are campaigning on it, and some winning on it. To the extent Karl Rove just the other day wrote an op-ed in the Wall Street Journal, I think it was, talking about how to fight this growing socialism.
Which is such a sign of our success.
Well, the fact that Karl Rove's against it is a no-brainer, and it is a sign of success that he has to write an op-ed like this. But some of the opposition is inside the Democratic Party. It's not the Karl Roves that's the problem. In California, you tried to pass...
This will be our biggest form of inoculation.
You almost passed it, and it was actually within the Democratic Party that it didn't pass. So what's the state of that fight?
So the way we kind of look at it, over the next year is there's going to be 3 primary areas of inoculation. And everybody sort of really knows the first two, the for-profit hospital industry and the pharmaceutical industry. But the third, most people don't know, which is what you just named, the extreme center of the Democratic Party. And what they're going to propose is a public option, something like a Medicare Extra, Medicare Advantage, Medicare buy-in. And what a public option does is, it creates an option for people to get publicly funded health care, but who's going to get that health care? People who are going to opt to get that health care are going to be the sickest individuals. And so what it's going to do is it's going to make it look like single payer would be extraordinarily expensive, because while this public option is covering the sickest individuals, those who would essentially be cherry-picked are going to self-select into insurance. And insurance, by some miracle then, is going to be able to cover everybody so much more cheaply. And the neoconservatives and the libertarians are going to take this and run with it and make it evidence for why a single-payer system won't work in our country. And so we are trying to get...
Just to be clear for people who haven't following the issue so much.
Yeah,
this
sure,
this is kind of what was proposed back during the Obama...
Yeah, that's right.
And the hearings where Baucus was there, and they didn't, and they gave up on it. But the idea is public option would compete against private insurance companies.
That's right.
In
So
some
the
big open
private
market.
insurance industry still remains in the driver's seat. And our fundamental position is that the private insurance industry must be taken out of the driver's seat. Human need needs to be in the driver's seat. And the public option leaves the private industry, or the private insurance industry, essentially intact. And again, puts all the sickest individuals taking in that option, making it look like more expensive than it is. It's going to set us up for failure.
So to return to the theme, there's a whole section of the leadership of what some people call corporate Democrats
yes, that are proposing
that
this.
hate the Medicare for all and want to defend the
Right.
Insurance companies.
That's
so
right.
how is that fight inside the party going to unfold?
So right now, and this is the kind of thing that's happening in our table in D.C. Over the summer in July, NNU worked with Pramila Jayapal to establish a Medicare for All caucus in the House. And this is not going to be a fully adequate answer to the question that you asked, but basically the entire role of that caucus is to educate members of the House. This would be those who are on or willing or interested in getting on H.R. 676, the Expanded and Improved Medicare for All Act, about what single payer actually is. Because
Can you get one of the committees to hold hearings with subpoena power and make a big drama out of it?
What we're trying to do is, and we're trying to use the field campaign to do that. So right now, what we've got set up, and this is happening, it's in the works right now. It's leading up to a sort of climatic week in February, from February 9th to the 13th. We are targeting key Democrats in the Ways and Means Committee and Energy and Commerce Committee. These are the two regulatory committees for the House. In order for the bill to get a hearing, it has to get through these committees. And so we are going to hold something called a barnstorm, which is an organizing meeting that has a built-in action component and also has a sort of built-in ladder of engagement so that people come to that meeting, they do an action right on the day of the meeting itself, but they're also given a long-term plan of engagement that's extraordinarily concrete and that is designed to hold them accountable to literally put in thousands of phone calls in each of these districts for these representatives to get on the bill, to support the bill.
Because it seems to me there's going to be a fight in the party.
Of course.
Over...
There already is.
Oh, I know. But over these hearings, either focused on trashing Trump, or the hearings, I mean, fine, trash Trump, but are there going to be hearings that really create a vision for new policy?
There better be. I mean, 70% of the American people have been demanding this. We have a bunch of freshman electeds who ran on Medicare for All. I think that actually their ability to make this a core issue in the next legislative session is going to determine whether or not a lot of these people get reelected.
All right, thanks for joining us.
Thank you.
And thank you for joining us on the Real News Network.